Hello everyone, and welcome to your last video seminar of the semester. So in this week's lecture we looked at personality and the different theories of personality. So I thought it would be a good way to round off the term to talk about another area of individual differences psychology, this being personality disorders. Now there are loads of personality disorders, but we're going to look at two today, and that is borderline personality disorder and antisocial personality disorder. But to start off with, what is a personality disorder? So we remember from lecture that personality refers to individual differences in characteristic patterns of thinking, feeling, and behaving. So this remains stable over time and is a predictable way of knowing how someone will act if you know their personality. So it therefore makes sense that a personality disorder is a pathological way that someone thinks, feels and behaves. So in some way, some kind of mentally unwell way of processing this information. The Diagnostic Statistics Manual describes many personality disorders, but as I said in this session, we're going to briefly cover the causes and symptoms of borderline personality disorder and antisocial personality disorder. We're going to cover the NHS criteria for those symptoms, and we're briefly going to discuss the treatments. So what causes personality disorders? Well, personality disorders can be caused by a number of things, one of those being genetics. Now, of course, this is the biological approach to personality disorders, and this states that genetics is actually the cause of the disorder. Now, research shows that things such as aggression, anxiety, fear, etc., those things that might be associated with the development and maintenance of a personality disorder can be things that are passed down in your genes. And actually researchers found that a malfunctioning gene can actually result in a greater incidence and a greater intensity of obsessive compulsive disorder. Another cause of personality disorder, and one which has been linked with the most personality disorders, is childhood trauma. There have been many studies that have looked into the association between experience of childhood trauma and the development of personality disorders. And indeed, researchers consistently found that childhood sexual abuse is more likely to result in borderline personality disorder. However, different types of childhood abuse, childhood trauma, can lead to different disorders. For example, chronic long-term childhood abuse has been associated with the development of dissociative identity disorder. Now, this is where people develop different identities, different alter personalities, and this helped them. This was a coping mechanism as a child to deal with that childhood trauma, that experience of being in a situation that's very traumatic but that they can't escape from. So they develop these different alters, these different personalities, to help them to deal with things that they find too aversive to deal with as a result of their trauma as a child, and not having the mental capacity to be able to process this trauma at the time. Now, in addition to physical and sexual abuse, verbal abuse has also been strongly associated with the development of personality disorders. In a study of 793 mothers, those who admitted to screaming and shouting at their children, threatening them and telling them that they didn't love them, were more than 3 times more likely than mothers that didn't to have children that ultimately developed narcissistic personality disorder, borderline personality disorder, or obsessive compulsive disorder. Now, another more controversial association with the development of personality disorders is high reactivity. Now, this is where children have a sensitivity to light, noise, and texture. And it has been found that children who do have this sensitivity are more likely to develop social phobias and personality disorders. However, up to 20% of children experience high reactivity, and we know that less than 10% of people go on to experience social phobias, and even fewer go on to experience personality disorders. Now, the final cause, peers, is actually more of a protective factor. So, if children have multiple or even just one strong friendship in childhood, this can serve as a protective factor against the development of personality disorders in adulthood. However, the absence of a close peer connection in childhood can lead to an association with the development of personality disorders in adulthood. Now, I'll go on to discuss these personality disorders next. So first we'll discuss borderline personality disorder. Now, borderline personality disorder affects more women than it does men. And the symptoms of personality disorder are grouped into 4 main areas. Now, these include emotional instability, and the psychological term for this is affective dysregulation. Disturbed patterns of thinking or perception, so these are cognitive distortions or perceptual distortions, impulsive behaviour, and intense but unstable relationships with others. So, how do these main areas of symptoms manifest? Well, the emotional instability can manifest as extreme worry about people abandoning you, and very intense emotions that might last a few days, a few hours, or a few minutes. These emotions will switch faster than you might expect for someone with bipolar disorder, and it can be very distressing for the individual, but also for the family, friends, and people with whom they're in romantic relationships. The disturbed patterns of thinking or perception, now this can be thinking that people don't like you, not having a strong sense of who you are, finding it difficult to keep and maintain relationships because you feel that they are manipulating you, or perhaps you're manipulating them. Impulsive behaviour, so using drugs, alcohol, binge eating, or restricting your eating, and also engaging in risky sexual activity, and intense but unstable relationships with others. So again, as I said, sort of having very intense relationships with partners, falling in love very quickly, and pushing people away when you're scared of being abandoned. Now, these are all symptoms that are associated with borderline personality disorder, and they may range from very mild to very severe. These symptoms usually emerge in adolescence and persist into adulthood, and it's generally thought that whilst the symptoms of borderline personality disorder can be moderated with medication, it can't be cured as such. Now, antisocial personality disorder, this actually affects more men than it does women. So, a person with antisocial personality disorder may exploit, manipulate, or violate the rights of others. They'll show a lack of concern, regret, or remorse about other people's distress. And this actually helps them to exploit, manipulate, and violate the rights of others because they lack that empathy. They behave irresponsibly and show disregard for normal social behaviour, so they don't feel as set in their ways by social cues, by social norms as others may do. They have difficulty sustaining long-term relationships, again because they behave in a very antisocial and manipulative way. They often have anger issues. They're unable to control their anger. And they lack guilt and don't learn from their mistakes. And this is again associated with their lack of empathy. They blame others for the problems in their own lives, and they repeatedly break the law. A disproportionate amount of people in prison institutions have been diagnosed with antisocial personality disorder. So it is very heavily linked with crime. a person with antisocial personality disorder will have a long history of conduct disorder back from when they were children, such as truancy, delinquency, and other disruptive and aggressive behaviours. And again, antisocial personality disorder is comorbid with drink and drug problems. So what are the treatments for personality disorders? Well, as I mentioned earlier, personality disorders can be quite treatment resistant, which means that once you have been diagnosed with a personality disorder, if this diagnosis is correct, it's likely that you'll live with this personality disorder for the rest of your life. However, different treatments can help you to manage the symptoms of your disorders, and you can live a relatively normal life if you maintain treatment fidelity, which means if you sort of go along with your treatment plan. So talking therapies are considered to be very important when it comes to the treatment for personality disorders. Now, the two that we're going to discuss are cognitive behavioural therapy and dialectical behaviour therapy. Now, cognitive behaviour therapy works with your cognitions and your behaviour. So this means that it addresses the negative cognitions, so the negative thoughts that you experience often if you have a personality disorder or other mental health condition. So, for example, if you have borderline personality disorder, you might be terrified that your partner will leave you. And this might cause you a lot of distress, and this might cause you to push them away, and ultimately this might end relationships, this might cause you a lot of upset, this might cause your partner a lot of upset, and ultimately one of the ways that people with personality disorders can feel a sense of stability is to have a healthy and stable relationship. So your CBT therapist might work on that as part of your therapy. They might work on that cognition that your partner is going to abandon you by addressing that cognition, by asking for evidence to support the cognition, evidence to counteract the cognition, and to help you to understand how your cognition actually isn't supported by evidence. Now, hopefully, by addressing this cognition, you can then change the behaviour that's associated with this cognition, with this panic. And by going through these negative cognitions, these negative automatic thoughts, your therapist is able to help you slowly change your behaviours and teaches you to yourself address these cognitions on your own. So what's DBT? DBT is dialectical behaviour therapy, and it's based on cognitive behaviour therapy. However, it's been designed specifically to address those participants, those clients who have very varied emotions, whose emotions vary intensely. So the aim of DBT is to understand your difficult feelings and learn the skills to manage those difficult feelings in order to be able to make positive changes in your life. Now, CBT helps you by helping you to change your unhelpful ways of thinking, whereas DBT focuses on accepting yourself at the same time. So these two therapies have been found to be very helpful in the treatment of personality disorders. Finally, we have medication. Now, there is no pill that's a one-size-fits-all for people with personality disorders. However, there are medications that can help. For example, SSRIs, so selective serotonin reuptake inhibitors, that are used to treat depression, may help to alleviate some of the depression symptoms that people with personality disorders that may face. They may also be prescribed antipsychotic medication to help them to calm and challenge negative automatic thoughts and psychotic thoughts. So this medication, in collaboration with talking therapies, can help to allow participants, allow clients to cope with their personality disorder and to live a meaningful life outside of their personality disorder. So thank you very much for coming to for watching the seminar video today. This is the last seminar video of the term. Please post any questions in the associated forum or ask in class. Thank you very much, guys.